Good morning and welcome to our webinar, Understanding Florida's Mental Health System. My name is Robin Coker. I'm the Director of Communications at Disability Rights Florida. I'm a white woman with blonde hair wearing glasses and a white shirt with peach-colored flowers. On the screen, we have a PowerPoint slide with a white background, purple lettering, and the DRF logo. The speakers for today's webinar are Erin Victoria, a Senior Advocate-Investigator, and Melissa Cyril, a Rights Training and Outreach Coordinator, both with Disability Rights Florida. As a program note, there is a lot of information to provide on this topic, and we expect to exceed our usual 60 minutes. We're estimating this presentation will run about an hour and 15 minutes. So if you need to leave before the end, please feel free to do so, and you can catch the ending posted on our website later this week. First, we will review the accessibility features of this webinar. Our webinar includes closed captions and American Sign Language. Closed captions are available at the bottom of your screen by using the button that says CC. We also have 2 American Sign Language interpreters today. They are spotlighted on your screen and will be visible at all times. If you cannot find them, make sure your participants setting shows all video participants. If you have questions during the webinar, please submit them in the Q&A. The Q&A is at the bottom of your screen. You can also send your questions to the email address webinar@disabilityrightsflorida.org. We will answer them at the end of the presentation. And as a caution, please don't put personal information in the Q&A. Lastly, the webinar will be recorded and posted on our website and YouTube channel. Now that the housekeeping is complete, I'll pass things along to Erin and Melissa.
Sorry, I had myself muted. Good morning, everyone, and thanks for joining us today. Robin, thank you for the lead-in. My name is Erin Victoria, and I'm a Senior Advocate-Investigator with Disability Rights Florida. If you're not familiar, Disability Rights Florida is this federally mandated protection and advocacy agency for people with disabilities in the state of Florida. So as an advocate investigator, I typically find myself working with our clients with mental illness, specifically in facilities such as Baker Act receiving facilities, state prisons, state hospitals, county jails, so on and so forth. So that's kind of my niche, is assisting our clients with mental illness in inpatient settings and in correctional settings. I also work as the PAIMI program coordinator. So Disability Rights Florida is funded by a batch of federal grants, one of them being the Protection and Advocacy for Individuals with Mental Illness, the acronym being PAIMI. So as the program coordinator, I oversee that grant. I write the application every year that has to be submitted to the federal government. I also do the end of the year reporting that we have to send to the federal government as well. And I joined Disability Rights Florida in 2020, right in the height of the pandemic. And I've been with the agency for about 5 years now. And so I will pass it over to Melissa to introduce herself.
Hi, thanks, Erin. My name is Melissa Cyril. I am the Rights Training and Outreach Coordinator on the investigations team at Disability Rights Florida. Similar to Erin, I also advocate in inpatient mental health settings. I also help coordinate most of our rights trainings in mental health settings, such as inpatient units, mental health clubhouses, drop-in centers. And I joined Disability Rights Florida in 2006. So I've been with the agency for almost 20 years. Thanks, Erin.
Mm-hmm. So today we're going to be talking about Florida's mental health system and pretty much helping to give you all the information that you need to navigate the mental health treatment world in Florida. Being that you're attending this webinar, we're assuming that most of you have experience in the mental health community, or trying to find services and providers, and so we're here to provide you with that information because there's a lot of moving parts in the mental health system. So that is our goal for today. So to achieve that goal, we're going to provide a basic overview of the mental health system. What are the different types of programs? How do you access them? We're also going to review the types of mental health treatment programs in Florida, as I just said, and then provide you with some resources to help you find services. So at the end, we're going to have some resources to put you in contact with Disability Rights Florida and some of some of the services we typically work with. Just a general overview of today's presentation. I'm going to start by talking about the substance abuse and mental health program. Then we'll move on to talking about peer-based community resources, some housing options, and then end on resources for finding care and information. So I want to start by talking about Florida's mental health system. So when we talk about Florida's mental health system, really the top of the hierarchy of the mental health system is the Substance Abuse and Mental Health Program, which is a single state authority on substance abuse and mental health as designated by SAMHSA, which is the Substance Abuse and Mental Health Services Administration. So SAMHSA is the federal administration, and they administer the substance abuse and mental health services for the entire country. And then the SAMH is the program that doles out those services for the state of Florida. So the Substance Abuse and Mental Health Program is governed by chapters 394 and chapters 397 in Florida statutes, and it is responsible for the oversight of the system of care for the prevention, treatment, and recovery of children and adults with serious mental illnesses or substance abuse disorders in the state of Florida. So with the SAMH at the top overseeing those services, DCF is the Department of Children's and Families. I'm sure most of you have had experience with DCF or know who they are. They are the agency that is tasked with managing and overseeing the mental health services and supports around the state. So they oversee many of the programs that we're going to be talking about today. These are most notably the Substance Abuse and Mental Health Program, which we talked about being at the top of the hierarchy. They oversee community mental health centers, residential treatment facilities, therapeutic foster care, and group homes. And then moving down the chain of hierarchy, we have what we call managing entities. So by definition, managing entities are corporations that are selected by and under contract with DCF to manage the daily operational delivery of behavioral health services through a coordinated system of care. And we typically refer to managing entities as MEs. So in short, DCF contracts behavioral health services through regional systems of care, and these are the MEs. So they're regional systems of care. So when you look at the map of Florida, DCF splits it into 7 regions, and each region has a designated managing entity that is contracted with DCF. And the primary role of the ME is to plan and manage behavioral health services through a coordinated system of care, as I outlined in the definition. So this is a map of the managing entities in the state. So depending on where you are, the mental health services will fall under that managing entity. So for example, I work out of our Gainesville office, so I'm in Alachua County. So that is, I think, let me see. It is no, are we Lutheran? I think we are the Lutheran Services of Florida, is what we're under in Alachua. I should know that better, but for some reason it slips my mind. But so this is a map of the managing entities. We have 7 total in Florida. So with the managing entities, it's important to remember that they don't provide direct services. They are there to use DCS funding to make sure that DCS funding is tailored to the specific behavioral health needs in the various regions of the state. So they identify region-specific needs in the area that they are tasked with overseeing, and they determine how the DCS funding should be tailored to fit and meet the treatment needs of that community. So these managing entities then contract with service providers in the community to provide mental health care and some substance abuse services to individuals in the community. And so the managing entity is responsible for oversight of those service providers. So when you're looking at that hierarchy, it's DCF, they contract the managing entities, which are regional. The managing entities, they identify the needs of each region, and then they contract the service providers to provide services to meet those needs. So if you're having a problem with the service provider, you should start with speaking with the service provider first. If you can't resolve your problems with the service provider, reach out to the managing entity in your region. If that doesn't work, then you go to DCF. So you can work your way up that hierarchy. So now I want to move on to talking about the different types of mental health treatment programs throughout the state, specifically our inpatient community-based programs and also our inpatient programs. So starting with our community-based programs, we have community mental health treatment centers. And so by definition, CMHCs are community-based providers who are contracted by the managing entity and provide services directly to individuals in their community. So people who need services get those services by accessing the CMHC in their area. So CMHCs are publicly funded, not-for-profit centers, and again, they operate under contracts with their region's ME. And each CMHC reflects the special needs and resources of the community that they are providing services to. And while they provide a wide arrangement of services, to be a certified CMHC, they have to provide at least these 4 services. So inpatient services, outpatient services, day treatment, and emergency services that are provided 24 hours per day. And some examples of CMHCs are the Community Health of South Florida, which is in Miami, and the Central Florida Recovery Center, which is in Orlando. So what are some benefits of CMHCs? Well, one of our greatest goals and missions is to really make sure that individuals that require mental health services, that they receive the services that best meet their needs in the least restrictive setting as possible. And so the ultimate goal here is that individuals are able to stay in their homes and access the services that they need. And CMHCs allow individuals to do that by making sure they can remain at home and then go to the CMHC to access the services they need. And we understand that not every case can end in the individual staying at home. There are folks that require inpatient care. There are folks that require many different levels of care. But ultimately, we would like to see everyone be able to remain at home with their full dignity and accessing the care that they need and still being able to be in their home. So CMHCs, again, they accomplish this by providing comprehensive range of services near the individual's home. So we all know that one of the major barriers to individuals accessing mental health care is transportation and getting to the facilities where they need to access their care. So CMHCs provide a local option, so that is good. They also provide services to all persons regardless of their ability to pay. So you're not bound by financial restrictions. Because they provide comprehensive range of services, they also permit patients to transfer easily from one type of service to another as their needs change. So as you know, mental health ebbs and flows. So sometimes you may require more intensive treatment and an inpatient care. Other times you just need a little maintenance and outpatient care. So CMHCs offer all those different types of services, and you can move between those types of care, as required. And then also CMHCs strengthen community resources for the prevention of mental illness by being present in the community and providing those services. So now I want to move to talking about inpatient treatment facilities. And the first type of inpatient treatment is what we refer to as receiving facilities. This is a long definition of receiving facility for a receiving facility, so I'm not going to go through it word for word, but basically they are facilities that provide acute care services to individuals that are experiencing a mental health crisis or a substance abuse crisis, to the point that they're a risk to themselves or others. So they have to, they are sent to a receiving facility where they can be stabilized, to the point where they're no longer a risk to themselves or others. Services at a receiving facility are available 24/7, and they're intended to be brief, intensive alternatives to full hospitalization. So the main purpose of a receiving facility is to make sure that they can receive crisis care, but not have to go directly to a state hospital or to, be institutionalized at a hospital. And when we say receiving facility, we also, you might more commonly hear the term crisis stabilization unit or Baker Act receiving facility or Baker Act facility. All those terms are meant to refer to a receiving facility. So as I stated, at receiving facilities, patients arrive under emergency conditions for mental health or substance abuse crises. And at the facilities, they receive evaluations and treatment. And if the facility, for one reason or another, is unable to provide the patient with the care that they need, or they're unable to stabilize them after a set amount of time, they would then transport that individual to the appropriate service provider. So in our work, we often see maybe someone arrives at a receiving facility with a severe injury and they require medical care. Well, if the facility doesn't have the ability to treat that medical issue, they would then send them to a hospital to be treated, and then they would return to the facility once the medical issue is resolved. Or, for example, their mental health is just at a point that the facility cannot manage or treat, then they would petition the court, and if the court approves, they would be sent to a more intensive facility where they can provide the services that they need. But receiving facilities are especially designated by DCF. And again, they're meant to provide short-term treatment for acute mental health crisis situations and also substance abuse situations as well. So moving in, intensity and time frame. So receiving facilities are those very short crisis care for acute situations. We have SRTs, which are short-term residential treatment facilities. And again, SRTs provide step-down services for residents of CSUs. And what they do is they allow for more extended but less intensive level of active treatment for psychiatric conditions. So for example, if someone is at a receiving facility and they've been stabilized, but still require, they still require some kind of inpatient care and treatment, whereas sending them back to the community maybe isn't the best option for them. But they don't need a high enough level where they have to go to a state hospital. Facilities may send them to a short-term residential treatment facility. And the purpose here is to fill the gap between crisis care and long-term hospitalization in a residential treatment facility. So it's meant to divert folks from going to state hospitals. So the short-term residential treatment facilities gives a less intensive treatment option for folks that maybe require a little bit more care than the receiving facilities can provide. And some examples of these, down in Bartow, Peace River Center has both a CSU and the SRT. And so they'll transfer folks who've been stabilized but still require ongoing treatment from the Peace River Center CSU over to the SRT. So moving forward in intensity, we have state mental health treatment facilities. And these are state-operated facilities that are designated by DCF to provide extended treatment and hospitalization for individuals with serious mental illness. So again, these are for treatment needs that cannot be met by a short-term stay in a receiving facility, a short-term residential treatment facility, or in an outpatient community setting. So in order to be committed to a state hospital, a court of law has to determine that an individual has the symptoms of mental illness that have put them at substantial risk of self-neglect because they cannot care for themselves or survive on their own using all of their available supports. Or that they may inflict serious bodily harm on themselves or others. So it has to be a court order that determines their placement in a state hospital. And there are two types of clients that receive treatment in state hospitals. The first one are civil clients. And these are people that have been committed by the courts to receive treatment under the Baker Act. And this falls under Chapter 394 of Florida statute. So in this case, let's say someone is Baker Acted to a receiving facility, and after the 72 hours and they're unable to be stabilized, and the facility petitions for long-term or continued care and treatment. The court approves it, they would then be committed to the state hospital. And a lot of times the courts may say that an individual requires 30 days of extended treatment, and they're being committed to the state hospital to receive those 30 days of treatment. After 30 days, they would be reassessed. If they're stabilized, they would be discharged. If they're not stabilized, the court may approve them for another 30 days, another 60 days, so on and so forth. But this isn't the civil clients are those folks that have been committed to the courts to receive treatment under the Baker Act. So we have 3 state hospitals in the state of Florida. We have Florida State Hospital, Northeast Florida State Hospital, which is McClenny, Florida State Hospitals in Chattahoochee, and then South Florida State Hospital in Pembroke Pines. But on the other hand, we also have our forensic clients, which are a little bit different. And these are for clients that are committed to more secure facilities to receive treatment under the Forensic Client Services Act. And this falls under Chapter 916 of the Florida statutes. And so what the Forensic Client Services Act means is that an individual has been charged with a felony crime, but they were determined to be incompetent to proceed because of their mental illness. So when we say incompetent to proceed, or ITP, it means that their mental illness is interfering with their ability to understand the court proceedings and understand their criminal charges. So they'll be committed to a forensic facility or a forensic unit at the state hospital, where they are being treated for competency restoration. And in that, the primary goal is to restore the individual's competency to the point where they understand their legal proceedings. That is the only and primary goal of the forensic program, is to make sure that they can understand their criminal proceedings. And once they're determined to be competent in that regard, they would then be discharged and sent to the court, where they would go to trial and they would finish up their criminal proceedings. The other case for the forensic clients are individuals who have been adjudicated not guilty by reason of insanity, or NGI, after facing prosecution for a felony crime. So in this case, the court would determine that the individual, their competency is non-restorable, and that they are being committed to a forensic facility. So when we talk about forensic clients, it's anyone that's at the state hospitals that has a criminal charge attached to their commitment. So we have a few forensic facilities in the state. We have North Florida Evaluation and Treatment Center, Treasure Coast Forensic Treatment Facility, South Florida Evaluation and Treatment Facility, and then Florida State Hospital has a secure forensic unit on site. So moving forward, similar to the adult settings of the state hospitals, there are also inpatient settings for youth as well. And so these are the youth inpatient treatment facilities. The first type of facility is similar to the civil clients for the state hospitals. This is the statewide inpatient psychiatric program, or the SIP. And so these are for youth under the age of 21 with a serious mental illness or emotional disturbance that requires inpatient residential care. So for SIPs, referrals must be initiated by the local DCF office with the involvement of the parent, guardian, or family member. So if you're interested in seeking services in a SIP, you should reach out to your local DCF office. That's who makes the decision on eligibility for SIPs. And SIPs are funded by the Medicaid waiver program. And so, like I said, this is similar to the civil setting of the state hospitals, but for youth under the age of 21. So in the SIPs, they provide a number of therapeutic and medical services, as you see listed here. So they offer things like individual plans of care, medication management, educational programming, routine medical and dental care. So there's a variety of services that they provide. Most importantly, since they're dealing with youth under the age of 21, they provide the educational services as well. Moving forward, for the youth, you also have the Juvenile Incompetent to Proceed program, or JITPs. So these are like the forensic programs for the adults. So JITPs provide competency restoration services for youth who have been charged with a felony before their 18th birthday, or are unable to participate in legal proceedings due to their mental illness, intellectual disability, or autism. So they're for youth under the age of 18 who are unable to participate in legal proceedings because of their mental illness, intellectual disability, or autism. So like I said, it's similar to the forensic setting for adults. The JITP is overseen by DCF. So the primary goal of the JITPs is to allow youth to return to court to complete their proceedings. So just as I explained for the forensic settings for adults, the goal is competency restoration, to really educate them on the legal proceedings and to restore their competency so that they can understand and participate in the legal proceedings and have due process. So they really achieve this by helping each youth become knowledgeable about the delinquency process and their legal situation. And like I said, the goal, this is to ensure appropriate due process. And there are two ways that the JITPs can be administered. On one hand, they can provide community restoration services, so they can do this in the juvenile's home, in the detention center, or at their school. And the community restoration services are managed by Twin Oaks Forensic Outpatient Services. But on the other hand, when a youth requires a more secure setting, the JITPs can be provided in secure residential services, and this takes place at Apalachicola Forest Youth Camp, which is up in the Panhandle. It's the only secure residential facility for youth in the state. So it is in Liberty County, Florida, and it is managed by Twin Oaks Juvenile Development Incorporated, which is under contract with DCF. So those are a very quick rundown of our certain types of inpatient programs in the state. I now want to move forward and talk about some of the community-based mental health services. And the first one of these is the Florida Assertive Community Treatment. So these are commonly referred to as FACT teams. Most of you have probably heard of FACT teams. But what they are interdisciplinary teams that deliver comprehensive care to individuals with serious mental illness while in the community. So on the FACT team, a FACT team, even though they consist of a wide arrangement of professionals, they must include a team leader, a psychiatrist, a nurse, a peer specialist, a substance abuse specialist when applicable, a vocational specialist, case manager, and administrative assistant. So they have to include those professionals. They can include some other, they typically include other types of mental health professionals as well. But they must include that folks from that list. And so the FACT teams assist adult clients with severe and persistent mental illness. And so really what they're looking for when the managing entities are figuring out eligibility for a FACT team is they're targeting folks who have, are constantly being cycled through the institution. So they're looking for individuals with a repeated history of hospitalization, admissions to state hospitals, homelessness, incarceration. So the goal of the FACT team is to stop that vicious cycle of reinstitutionalization and consistent institutionalization. So the FACT teams target folks that have a history of repeat institutionalization. And so the eligibility for a FACT team is determined by the managing entity in the region. So if you are interested in seeing if you or a loved one is eligible for FACT team services, you would want to reach out to the managing entity in your region, and they would be able to run an assessment for you. So the goal of the FACT team is to ensure that clients can live as independently as possible in the community and to prevent clients from returning to inpatient care or prison or jail. The FACT program is recovery-oriented, strength-based, and person-centered. So again, the goal is to make sure that the individual can live as independently as possible and prevent them from returning to prison or jail. So a lot of times when folks get out of the state hospitals, they might be set up with a FACT team to make sure that they have continued care in the community and they don't wind up getting sent back to the state hospitals. So FACT teams, again, they provide 24/7 individualized wraparound outpatient care plans. So some of the services that they provide, I have a list here, but they include things like financial supports, vocational services, transportation to appointments if you need it. And so, like I said, to make an appointment with a FACT team, you'll want to contact the managing entity in your area. So the FACT team specifically work with adults, but they have the same program for youth as well. So they're called CAT teams, Community Action Treatment Teams. So like I said, they are similar to the FACT teams for adults, but these are meant for children and young adults. So in 2025, there were 71 total CAT teams in the state. And depending on what part of the state you live in, availability of CAT teams varies. And going back one slide, I forgot to mention that there are 43 total FACT teams for adults in the state. And again, it varies by managing entity. So if you're up in the Panhandle, there might not be as many FACT teams as there are, say, in Central Florida. The next type of community-based service are mobile response teams. And mobile response teams, they are teams of professionals that provide 24/7 emergency behavioral health care on site to anyone at any place in the state of Florida. And the goal of the mobile response team is to provide immediate on-site crisis care to individuals experiencing a mental health crisis and are at risk of harming themselves or others. And the goal of the mobile response team is to keep the individuals, to address the mental health crisis right there on the spot, and to stop the individual from maybe, engaging with police and being arrested due to symptoms of their mental health, or ending up going to a Baker Act facility or a state hospital. So it's really meant to divert placement in institutions and to provide crisis care on the spot. And so when you call a mobile response team, there will be a team of professionals that show up, usually consisting of a licensed mental health professional, certified peer recovery specialist, and access to an on-call psychiatrist. And the mobile response team services are not pinned on your ability to pay. And you can request a mobile response team by calling their number. I have a list of numbers on the next a map on the next slide that has all the numbers. It will be kind of hard to read, but you can find the full list of mobile response teams on the DCF website. So if you require a mobile response team, you would call the number and they would dispatch the team to your house or wherever you are, if they're available, or you can call 988 as well. And like I said, the goal of the mobile response team is to lessen trauma, prevent unnecessary hospitalization or arrest. So as we know, a lot of times when an individual is in crisis care and the police arrive, the MTs arrive, there is a possibility that they're going to resist arrest or fight back. And they're going, due to symptoms of, psychosis or extreme paranoia, or whatever mental health crisis they might be experiencing. And that often leads to arrest or institutionalization. So the mobile response team is meant to prevent that unnecessary arrest or hospitalization. They're also meant to ensure that mental health crises are addressed by mental health professionals and not directly by emergency departments or police. We see too many cases where police, and a lot of police do very good jobs with mental health crises. They're very challenging to deal with, but in a lot of cases, some police are not trained to address mental health crises. So we see a lot of cases where police show up and they completely mishandle a mental health crisis, and it results in arrest as a result. So how do mobile response teams assist? I kind of walked through all this already, but to review, when a mobile response team receives a call, they'll dispatch their team for immediate assessment and intervention to the person in need. And during that intervention, they often provide referrals and support services, and they'll also link the individual to appropriate community resources, because again, the goal is to keep the individual in the community. So this is that map of the mobile response teams that I mentioned, but you can see here it varies by managing entity. So up in the Panhandle, there's only 3 mobile response teams for the entire Panhandle. So you might be a few hours, a mobile response team might be a few hours away, and if you call for a mobile response team, you're probably more likely to have emergency responders or the police arrive on site. So if you are interested in stumping for, adding more mobile response teams to your region, you would want to contact the managing entity and voice your concerns to them. And so the last thing I will talk about for this section and type of community-based services are coordinated specialty care for early psychosis, or CSCs. Now, CSCs are recovery-oriented treatment programs where a team of specialists work with people who have experienced first episode psychosis. Now, most cases of first episode psychosis occur when people are in their teens or early 20s. So the goal here is to identify that first episode psychosis as early as possible and provide treatment for it and help the individual manage the mental illness, before it progresses. So the goal of the CSCs is to provide treatment and recovery support to give people with first episode psychosis the best chance to live their lives and not be disabled by their mental illness. So you want to identify it as quickly as possible. And they achieve this by developing recovery-oriented treatment programs and linking individuals with services as soon as possible after they experience the beginnings of psychotic symptoms. So CSCs, they really work with individuals through shared decision-making, and they do this to create an individualized personal treatment plan that focuses on the specific ease of access to care for the individual. So it's about tailoring a program to the specific needs of the individual, which is important because, you know, what one person may require from their CSC might be completely different from what the other one, another person may benefit from. And so treatment plans include things like psychotherapy, family education and support, case management, work education, or work supports. And again, when we're looking at the map for CSCs throughout the state, there is one CSC per managing entity. So if you require the services of a CSC, you would call the number. You would reach out to your managing entity. And again, all of these maps that I've shown on this section of the presentation, if you go onto the DCF website, they have these maps available. So now we're going to move on to talking about peer-based community resources. So I will pass it off to Melissa from here.
Thanks, Aaron. Okay, so now we're going to discuss the peer-based community resources, which are going to include peer support, drop-in centers, clubhouses, peer respite, and warm lines. So peer support is a system of giving and receiving help founded on key principles of respect, shared responsibility, and mutual agreement of what is helpful. You can find peer supporters in various different settings, such as crisis stabilization units, in state hospitals, at clubhouses, drop-in centers. They also work on warm lines and crisis lines. So a Florida Certified Recovery Peer Specialist is a designation that's given to individuals who have undergone special training, which includes 40 hours of approved training in various different topics, and also 500 hours of working in peer support role. A peer specialist is someone who uses their lived experience and training to help others who have a mental health or substance abuse conditions. And their trainings include various different things, including recovery support, mentoring, advocacy. And a Florida Certified Peer Recovery Specialist is someone who is willing to self-identify as a person who has direct personal lived experience with recovery with their mental health or substance abuse conditions. And they're willing and wanting to use their experience to help others with their recovery. They also have to be willing to publicly identify as someone who is living in recovery so that they can be, they can help others with role modeling, educating, and providing support when it comes to recovery. And like we mentioned before, they have to have the proper training that includes the 40 hours in those special topics and experience to work in that provider role. And peer specialists can be found in any of the community-based settings that we're going to discuss. So drop-in centers. Drop-in centers are centers where individuals who have serious and persistent mental illness can go to, and they can learn to become independent. They can develop and operate. They help work with the centers. They develop and operate the moving parts of the center. They participate in the social and recreational networking of the centers. And it's really gaining support from peer volunteers there, individuals who they can rely on and have been through those experiences with them. There's different centers throughout the states, and all their hours vary by location, so you really have to look them up. But they really do frequently offer availability on evenings and weekends and holidays when volunteers are available as well. They provide various different services. The services will vary depending on locations, but when it comes down to it, they want to provide self-help, mutual support groups. They do on-site activities such as arts and crafts. They have guest speakers come out. They hold social events. They take members out to the community to do different sorts of gatherings. They provide access to computers there, so individuals can use computers to access to learn different sorts of networks and opportunities, and also employment support. They help individuals gain employment in the community. Clubhouses, there are voluntary organizations run by and for the members with the support of staff there. The staff help the members participate in all aspects of the clubhouse, in all aspects of running the clubhouse. So the Florida Clubhouse Coalition is made up of 20 clubhouses throughout the state of Florida. And they all share a common purpose. And the purpose is to provide support to adults who are living with mental health and living in their recovery. And they provide them with opportunities through friendships, through networking, helping them find employment, education support, lots of different community support as well. And in Florida, the clubhouses also belong to what's called the International Clubhouse Coalition. And internationally, there's over 300 clubhouses around the world. But like we said, in Florida, there are 20 clubhouses throughout the state. In the clubhouse, the goals include providing a restorative environment for individuals whose lives have been severely disrupted because of their mental illness. They use an evidence-based model to try to prevent rehospitalization of their members. And they use what's called a work order day, which utilizes the talents of each individual member of the clubhouse. And each person has a different job at the clubhouse to perform, and they all work together. So it's called a work order day. And just like drop-in centers, each clubhouse may provide a little bit different services, but the main things that they work on is to try to provide services to prevent inpatient treatment. So, but if needed, they help with access to crisis intervention services. They're going to provide their members with help gaining employment through their transitional employment program. They provide supportive and independent programs to help their members. And it provides a safe place for members to go to gain knowledge, to have socialization, and to help them find some housing. Now we'll move on to respite and warm lines. So a warm line is different than a hotline. A warm line is going to provide emotional support that can help prevent a crisis. Warm lines are staffed by volunteers who are in recovery themselves. A warm line in Florida, it's the Mental Health of America warm line. It's called the SETH line. You can call it anywhere in Florida that you reside, Monday through Friday from 6 to 10 at night. But that's just one example of a warm line here in Florida. Warm lines versus hotlines. So hotlines are when callers are in more of an immediate crisis, such as the 988 hotline, where warm lines are where you can still call if you're in crisis, but they're usually for callers who are needing more emotional support to prevent a future crisis. Respite care. So respite care is a system of temporary support and relief for families who are caring for a family member and they need a little bit of a break, we can say. There are options for residential respite care, there's some daycare, there's some in-home services, but they provide a little break for family members when they might need it. An example of this is the Federation of Families of Central Florida. They have a respite care program that they run. They also run a warm line as well, but they run a really good respite care. So we're going to show you a video on their respite care program. Sorry, I don't think the audio is working, so we can skip the video. But Federation of Families of Central Florida, that's just a video about their respite care program. You can always go on their website to find out more about their respite care program. But there's other respite care programs across the state as well. Okay, different housing options. We're going to talk about supportive housing, adult family care centers, and limited mental health assisted living facilities. So supportive housing is affordable community-based housing with flexible voluntary support services for individuals and families living with mental illness. And the goal of it is just to provide affordable housing combined with community-based services so that people who have mental illness may be able to live independently in their own apartment or residence. On-site services as supportive housing communities can include case management, day trainings. They may even have some drop-in centers and clubhouses as part of it as well. They may have some fact teams. They're going to want to provide some support for crisis support or emergency support as well. Adult family care homes. These are residential homes designed to provide personal care services to individuals requiring assistance, and they're all licensed through AHCA, the Agency for Healthcare Administration. So at an adult family care home, the home it's a smaller home. It has to consist of no more than 5 individuals who have a disability, or as they say, a disabled adult or frail elders. Those individuals cannot be related. The person who owns the home or rents out the home must provide the room, board, personal care, and it must be on a 24-hour basis. The adult care provider must live in the home with the individuals. And some mental health overlay services may be provided in the home, which will include like additional evaluations and some on-site services for the individuals with mental illness, which can include helping with medications and different sorts of case management things as well. But no more than 5 individuals who are not related. Then there's limited mental health. These are residential facilities that provide housing, meals, and other services, also licensed by AHCA, the Agency for Healthcare Administration. These types of homes are bigger than the other ones. They vary widely. They can be homes with less than 12 individuals to much more larger institutional-like facilities. The individuals who live there, they're going to have a community living support plan that's going to include different sorts of mental health services, to include medication management, different sorts of therapeutic activities. The staff there must be trained and equipped to assist the residents to carry out their daily living activities and to help them with their community living support plan. And then they're going to, like we said, offer some of those overlay services. So that's our basic rundown with different mental health services across the state of Florida. We want to tell you a little bit about Disability Rights Florida and who we are and what services and resources we provide here. So at Disability Rights Florida, we advocate, educate, investigate, and litigate to protect and advance the rights, dignity, equal opportunities, self-determination, and choice for all people with disabilities. And we do this through legally based advocacy services. We're consisted of multidisciplinary teams that are made up of attorneys, advocates, investigators, paralegals, specialists, and all sorts of other professionals. And all of our services at Disability Rights Florida are always free and confidential. So to contact Disability Rights Florida, our phone number is on the screen, 800-342-0823. We have TDD numbers on there as well. You can always go online, and that's the link to our intake form where you can go online and complete an on-site intake. You can visit our website. If you know anybody who may be inpatient in a mental health setting, we do have a direct mental health inpatient line posted in mental health facilities throughout the state. That number, it's not on the slide, but it's 833-500-1099. That will take you to an intake line on our investigations team, and it's strict solely for individuals who are inpatient in a mental health treatment setting. Aaron, you want to talk a little bit about the PAC?
Yeah, and I do want to apologize for the video not having audio. I think it was because my microphone was on mute, but who knows. As part of the PAIMI program, so again, PAIMI is Protection and Advocacy for Individuals with Mental Illness. As part of the PAIMI Act, Disability Rights Florida is required to have a PAIMI advisory council. And so the primary goal of the PAC is to oversee and provide input on all of Disability Rights Florida's PAMI-based work. So everything that we spend our PAMI grant funding on to assist individuals with mental illness, the PAC oversees that work. And so members of the PAC must have experience with mental illness. They can be former or current recipients of mental health care. They can be family members of individuals that have mental health diagnoses. They can be mental health professionals, attorneys that focus on mental health, or individuals that are just knowledgeable about the mental health treatment community. So membership to the PAC is 4 years. So we run on 4-year staggered terms. And new PAC member applicants are reviewed and interviewed by the PAC nominating committee throughout the year. So they're always accepting applications for the PAC. So, the PAC, we really strive to have diversity so that the PAC should represent Florida's population. So we try to have geographic diversity, racial, ethnic diversity, gender diversity, all of those. And so, they are always accepting applications from PAC. So if you're interested in becoming a member, you can submit an application online at the link there, or obviously this is from when we did our live presentation, but you can always reach out to Disability Rights Florida and we can send you a PAC application as well. If you're interested in becoming a member, I definitely encourage you to submit an application. It's a nice opportunity to have some insight on the types of work that Disability Rights Florida does for their clients with mental illness. And are we doing the input survey, or is that a holdover from Family Cafe?
Yes, I can, are you, if you're finished, I can go ahead and take over from here.
Yep.
Yeah. Okay, Aaron and Melissa, thank you so much. I appreciate you doing this for us. And before we begin taking questions, I want to bring your attention to the QR code. That is, do we put it on the screen? Yes. It will take you to a short survey asking for your opinion of the content of the presentation today. We'd greatly appreciate it if you could take a few minutes to give us feedback so that we can continue to improve the programs that we offer. There is also a link to the survey in the chat if you prefer not to use a QR code. You can scan the QR code or click the link now and wait until after the question answer session to complete this if you'd like. So we've got a good 15-20 minutes to answer some questions for you. So as a reminder, if you have a question, please post it in our using the Q&A button at the bottom of your screen. Please try to limit personal information about yourself so that we can maintain your privacy. So I'm going to go to the first question. And all right, do people have to be on the med waiver to qualify for SIPP?
I honestly don't have an answer to that because I don't work very much with the SIPs. Melissa, do you know?
I don't think they have to be on the med waiver, but they may have to be a Medicaid recipient. But there is a link that we can send you with that information too. Robin, do you have it?
Is that the one you posted in the chat?
Yes.
Yeah, okay, so that one should be available. If I remember correctly, it was, it started with the mobile response, did it not?
No, I'm sorry. I sent it to you, Robin. I can.
Oh, you sent it directly to me. Okay, I'll put it in the chat in just a moment then. Okay, let's move on to the next question, and while you're answering it, I'll get it there in the chat. So, what can a family do when there isn't availability with FACT?
Well, continue to call the DCF and try to get on with the FACT team or see if there is availability at some point. And often if there's a community mental health center in your area, you can access your community mental health centers as well. But this is a common problem that we see is folks either not being eligible for a FACT team or they're just not being one available and they kind of get put on a waiting list. So kind of the caveat to our presentation is that we understand that we're here to give information about the programs available. We understand that a lot of these programs have flaws, have shortcomings, and that is part of the work that we do on a day-to-day basis is to try to resolve those problems. So it's not a perfectly functioning system by far, but so when there is not availability of a FACT team, you just continue to call. If you been assessed and denied, request a reassessment. Or if that doesn't work, just, see if there's community-based resources as well. You could also reach out to Disability Rights Florida if you're having trouble getting access to a fact and you feel that you would benefit from one.
All right, thanks, Aaron.
Mhm.
And going back to that last question, Keith, I put it in the chat. I'm not sure if it's visible to everybody, but if you can make it visible, I'd appreciate it. Okay, our next question is, are all the MRTs in Florida now handling consenting adults?
I'm not 100%, Melissa, I'm not 100% sure about what you mean. Can I get some more information about the question?
That's all I've got right here. If the person who asked the question can go ahead and put some more information into the Q&A, then I'll bring that up after this next question. Okay. So the next one is, how are PD trained to deal with Tourette syndrome? Not sure you can answer that one, but I'll give it a
No,
try.
I don't know about that specifically. Melissa, I don't know, but I'll give
Yeah,
my
I don't
response
know about
first.
that specifically.
But I know that and it's something that we pay attention to. Many of the police departments do like crisis intervention training, de-escalation training, and things like that. And so we're starting to see more sheriff's offices requiring trainings for mental health, like crisis care and treatment and de-escalation and crisis intervention. However, there are, we are trying to keep an eye on the areas that don't and work with them to incorporate those kinds of trainings. So there are a lot of there are a lot of staff that are undertrained in regards to how to handle different types of mental health issues and different types of disabilities. So in a roundabout way, it varies on if and how police departments are trained to deal with individuals with Tourette's, and but it might be, in their specific training modules. I'm not sure.
And Aaron and I recently went to a clubhouse where they're actually incorporating clubhouse members, mental health clubhouse members, into their CIT, their crisis intervention training as well. So that we feel probably is being really helpful too.
Yeah, and so like I said, it's Florida, so some counties do a really great job and other counties do nothing. So it depends on where you are and what they're offering.
All right, great, thank you.
Mhm.
Another question is, does DRF assist or have resources regarding IEPs and 504s?
Yes, absolutely. We have a great team and education department here, a lot of great advocates who specifically handle IEP concerns or 504 concerns. So if you do have a concern, definitely contact our intake department.
Okay, good. All right, I'm going to go back to that question about the MRTs. So the person wrote in here, many MRTs are only for under 23 years old. Brevard now can handle adults.
I wasn't aware of. I'm not familiar with that because we've seen cases up here in North Central Florida, where the mobile response teams can handle adults as well. So that might be a county by county decision.
Yeah, I think so too. Maybe a county by county, because we've gone out to different places. We asked about their mobile response team and they didn't
Yeah.
like specialize in different areas. It was for anyone.
Mhm.
Any age group, yeah.
Yeah, differing services in different counties, unfortunately. Another question is there a specialized program or team to work with the deaf and blind?
That's a great question. And are you speaking specifically about Disability Rights Florida, or are you talking about like mobile response teams?
I think they're talking about mobile response teams.
So yeah, this is actually not the first time that this question has been asked, and we know that there is a lack of access to people on mobile response teams that provide services for individuals who are deaf and blind. And it's on our radar, and something that we are actually 2 years ago, we gave this presentation at Family Cafe, and we received a similar question, and it kind of raised a red flag for us. And so we've been looking into it, and we kind of have a mini project where we've been trying to incorporate this and find a way to address this like dearth of availability for these services. So yes, it is on our radar, and no, I don't. Again, it would vary by team, but from what we've heard from people in the community, that it's not common that you would find specialists who arrive with the mobile response team who can, can provide services for folks who are deaf and blind.
All right. This is our last question. So if anybody else has a question, please go ahead and put it in the Q&A. But our last question is, what state mechanisms are in place for newly discharged individuals to be followed after discharge?
So it depends, right, Melissa? Do you have an answer for this one?
I don't know if it's a state mechanism, but a lot of different individual locations have different policies and procedures where they follow up with individuals once they're discharged from different facilities.
Yeah, so I know at the state hospital level up here and that I'm familiar with, a lot of times they provide some short, making sure that they have prescriptions filled for a certain amount of time once they're discharged, making sure that they have appointments scheduled for up to 6 months, making sure they have access, that they have the option to get to those appointments. So they, many times they'll set up services, but unless you have a fact team, I don't think that there will be people like coming into your home to check on you unless I know sometimes for folks who are released from prison or from the state hospitals, sometimes there's some required in-home care that is part of their discharge plan, but that's something that when you encounter a discharge plan, you would want to try to work on that and get that written into the discharge plan if they offer it.
All right.
Sorry, Robin, I think there was a question about housing in there too. If the person's trying to locate some of the housing options.
Yes,
So
I'm sorry. You're right.
There's the Florida Supportive Housing Coalition. You might want to check them out or check out their website as well. And then there's also FloridaHousingSearch.org where you can try to search for those housing options also.
Good. Thank you. All right.
I think there was one more question that popped up.
And there are two in the chat as well.
Gotcha. Thank you. Okay. Are there data collected from DCF to have a breakdown of individuals with disabilities to receive mental health and addiction services?
So is that data on how many individuals with disabilities receive mental health and addiction services?
Yeah, it just says, are there data collected
So
from
DCF? DCF collects a lot of data. All their stuff is, is publicly available. So you can submit a records request. If the data is not available on their website, you can always submit a public records request and request that data. They have options for public records requests on the DCF website. If you just, if you go to the search bar on the website and look for public records request, fortunately we're in Florida where Sunshine Law gives us access to a lot of public records. So that is something you could submit a request for if you're interested.
All right, great. All right, another question is, how would I go about removing or sealing police reports on mental health calls of an autistic youth with crisis mental health history?
I don't know where you would start for that one. We just had a similar case not too long ago where they were looking to do that as well. Not for that specific reason, but for similar reasons. And I don't even know where you would start because I honestly don't have an answer for that.
Maybe call our intake line.
Yeah, you could call and then our attorneys might be able to take a look at it, and if it's like stopping the individual from getting services they need or stopping their access to a program that they're trying to get into, our attorney might be able to take a look at it and be able to advocate for removal, something like that.
Okay. All right. So to that person, either call our intake line or you can also go online and do an online intake at any time. All right.
And then, sorry, Robin.
No,
Go ahead, Robin. Sorry.
No. I was going to move on. So if you have something to finish on that one, that's fine.
I think Charles had posted one more question real fast.
Okay.
Do you want to read it?
Sure. Yeah. Where can I get a list of facilities for both outpatient and inpatients in Florida?
So DCS website, you can find a list of all their things on DCS website. They have it broken down by category with descriptions of what they offer, how many beds they have, so on and so forth. So yeah, go to the DCF website and you can find all that.
Okay, all right. And there was one last question. This person says they have a client that was ex parte Baker acted on in August, and the facility wants to discharge her to a shelter. Can they speak with somebody about how to get her into a SIPP? She has a long history of homelessness, elopement, and has been trafficked.
Is she under 21?
If that person can respond pretty quickly, we can get that. Yes.
Yeah, so they can reach out, they or their guardian can reach out to Disability Rights Florida and submit a request. And we might be able to, you know, because we have to have the approval of the consent of the individual or their guardian. Most likely we want to speak with the individual directly, the youth. But we might be able to walk them through their options and see what kind of options there are.
I can also post in the chat before as they're doing that, for our disability topics page on our website also has a little bit of information that goes through a little bit about the process too. So I can post that in the chat as well. But I agree with Aaron. We can also talk with them too.
Okay, and you said you are a guardian, so yeah, you could reach out to Disability Rights Florida or follow Melissa's steps that she just laid out.
All right. I think that's the end of our questions. Aaron and Melissa, thank you once again. Great information. So this concludes our webinar today. The webinar and the PowerPoint slides will be available on our website in about a week. So thank you for joining us and have a wonderful day, everyone.